Hey everybody, thanks for joining for this talk. Very excited to give this talk. Going to be learning a lot here. So today's topic is nutrition and diabetes in women. Um, and a little bit about me before we jump in is I'm a registered dietitian nutritionist. I'm also a certified diabetes care and education specialist, and I have my MBA as well. I've been doing this for about 7 years, working with patients one-on-one, and I'd say 90% of the time, what I'm helping patients with is diabetes and weight loss and pre-diabetes. So for today's talk, I want to talk about what an outpatient dietitian does. That's something pretty important to me. Not a lot of people know how much a dietitian could help them. We're going to talk about diabetes and obesity and the current concern that it has in women. We're going to talk about carbs versus proteins. We're going to talk about what a well-balanced diet looks like. What are some misconceptions about women's healthy eating? And I'd like for the participants here, the viewers, to think about some things you might have heard about men versus women and different nutrition myths, and maybe put that as some of your questions. I'd like to address those at the end. Is eating food that's organic more healthy? Should we take multivitamins? We're going to look at some labels. And we're going to talk about the dangers of the strict diet mentality. A lot of people adopt very strict diets and they end up not working. So I help people kind of create more sustainable diets. And those are all the topics for today. And then the Q&A is going to be very beneficial. People always have great questions that usually prompt other questions. So what does an outpatient dietitian do? One of my favorite things to hear when I finish working with a patient for a full hour is something like, oh, this is not what I was expecting. They were worried that I was going to put them on some strict diet where they're going to count every calorie or weigh all their food or eat, organic salad every day. That's not the case. That's not what dietitians should be doing. I learn about my patient's life. I learn about their schedule, their preferences, their snacks, their drinks, every little detail. And then I take all that information and I help them explore new foods, foods that fill them up, foods that make them feel their best. I put a big emphasis on focusing on reducing the frequency of food. There's often either too much food or too many snacks, a lot of picking and cravings we address. I help people create goals. So I'm not putting people on some strict diet meal plan, more so helping them set goals. I help them learn about proteins, fibers, healthy fats, foods that make us feel our best. And that's a lot what we're going to be talking about today, especially as it relates to diabetes and nutrition. Help people learn what to eat, when to eat, and how much to eat. And then the last point here is I'm not in one camp. There's not like one special nutrition plan that's better than another. And I make that point because I work with so many different people. I always say I work with, truck drivers and nurses and busy mothers and college students, and they all need different plans. So everybody gets their own kind of unique plan created for them, depending on their life. So let's jump in. The concern right now, diabetes, pre-diabetes, it's unfortunately increasing and it's getting worse year by year. Right now, it says 11% of adult women in New Jersey have diabetes. And the pre-diabetes number is very scary. It's 38.4%. About 2 million% of women in New Jersey have pre-diabetes. And this is 2021. So now we're hitting 2025 soon. And these numbers have gotten worse. And obesity is also up. Obesity and diabetes do go hand in hand. And when you help somebody lose weight, it also helps with their diabetes. So usually a plan is it's two birds with one stone. Obesity is up to 34%. So I know Dr. Patel is going to be talking a lot more about the specifics of diabetes and numbers, but I love this thermometer. I want to show this off. It's diabetes, the A1C. I'd say if you're unfamiliar with an A1C or if you've never had your A1C, I believe everybody should get their A1C checked to know where you fall. And I don't know if you could see my mouse, but down here on the left is 5. In the 5 is usually the non-diabetic levels. As you creep up towards 6, that's more of the pre-diabetic range. Once you start hitting 6.4, 6.5, that's a type 2 diabetes diagnosis. However, that's the green controlled zone of diabetes. And diabetes is this very large scale. So diabetes isn't one thing. Diabetes has different severities and different treatments, different medications at different levels. And Dr. Patel is going to talk more about this, but highly encourage people to check their A1Cs and to find out where they fall, if they're non-diabetic, pre-diabetic, diabetic, or a more severe case of diabetes. So big topic is carbs. And the next slide, sneak peek, is proteins over here, but carbs first. So carbs and diabetes, we've all heard lots of different things about carbs, you know, low carb, no carb, keto, Atkins, so many things over the decades. But carbs are one of the big concerns with diabetes. And the fact is, all carbs are going to raise our blood sugar. And it's tricky because it's unfortunately true that even if a carb is healthy or natural, it could still raise our blood sugar. That doesn't mean run away from them. So I give a very unique approach to carbohydrates, and that's just to be careful with your carbohydrates. So we have so many different kinds of carbs on here. We see soda, we see, you know, muffins and pancakes and bagels and cereals. They're not all the same, is the point of this slide. Some carbs that are better than others is one of them is actually a potato. A potato with the skin on it is a better carb, and at the end I'll tell you why. Fruit, there's a lot of confusion about fruit. Some people are like, oh, I have diabetes, I can't eat fruit. Some fruits are far better than other fruits. Something like berries, strawberries, raspberries, blackberries, blueberries, are far better than other fruits. They have a lot less sugar. One of the best carbs on the whole page is actually beans. That whole family, beans, lentils, quinoa, I have another slide here about them. They're the best carb by far. So why are these so good compared to something like pasta and rice? The reason is fiber. So when a carb comes with fiber, it lowers your blood sugar spike that occurs from the carb. So that's where we run into problems with all these kind of products, like muffins and cakes and cookies and soda. There's 0 grams of fiber, and there's also usually more sugar. So your blood sugar increases, you know, 2, 3, 4 times the amount. But whenever there's a fiber from potato skin, beans have some skin on them, berries have some roughage and some seeds, apples have skin, pears have skin. This fiber lowers the blood sugar spike. And fortunately, nowadays there's companies that are making products like wraps with fiber, cereals with fiber, breads with fiber. They even make healthy pastas now. So it's a lot to talk about in this talk today, but this is stuff I do in a session with the patient. We kind of set them up with some healthier products. Some of the carbs here that are better than others: quinoa, lentils, potatoes, beans, very good carbs. So protein, again, something else with a lot of confusion about over the decades, but protein does not raise our blood sugar. So as far as, you know, diabetes, I'm always asking patients to try to squeeze more eggs in or to add more yogurt. Just today, I was telling a patient with diabetes, I'm like, do you like cottage cheese? He's like, I love cottage cheese, but I've been staying away from it. Well, so let's bring it back because it's very good. It won't raise your blood sugar. You pair it with something like one of those good fruits, like berries. That's a perfect breakfast or a snack. Things like salmon, tuna, meat, these are proteins that are not going to raise our blood sugar. So onto some snack ideas. There's a big problem with snacks. It's usually because snacks are not snacks anymore. Usually people are having these things like granola bars or different kinds of things that are too dense. There's sugar in them. There's lots of carbohydrates. I like to get back to kind of small snacks. So I've made this list. Um, Things like celery, carrots, cucumbers, cottage cheese, yogurt, berries, nuts, pistachios, eggs, cheese, olives. Something I'm more of a fan of lately is something like these rice cakes because they're kind of big and they only have 15 grams of carbs. But these are some very specific snacks that are low in carbohydrates, low in sugar, and mostly all real food. I'd rather go for these first and recommend somebody to have some kind of a bar or a shake. Much prefer somebody to throw back some nuts or some berries as a snack. So meal tips, I've got a bunch, but these are some very convenient meal tips. A lot of my patients I work with are on the go or they're busy or they have quick lunches or, you know, I had somebody today who says he's just not interested in cooking. He never really cooked. And that's okay. We can still make it work. Eggs in all forms, one of the best things you could eat if diabetes and blood sugars are concerned. Things like tuna salad, chicken salad, turkey burgers, chicken burgers. These are all very quick, very convenient. A burger with no bun, a variety of snacks for lunch. Absolutely nothing wrong with that, especially if weight loss is a goal. Going back to the snack list, I see a lot of success in weight loss with patients when lunch comes around and they might have some cottage cheese, some berries, some nuts, and that's their lunch. When there was somebody who used to go for something like a sandwich or a sub or a slice of pizza, big difference. Going for a light lunch is a good strategy. So I have some actual specific pictures here of things I mean. Like when I say eat eggs, I don't mean just have one or two little hard-boiled eggs. have something substantial, have something you enjoy, right? This is like an omelet with, cheese, peppers, onions, avocado, something that's really filling. The word is savory. A turkey burger, you can get on a bed of lettuce with a little sauce, and we don't need that giant bun all the time, all that extra carbohydrate. Let your carbohydrates come from something in the salad, the vegetables, or some fruit, something natural, not always that sub or that wrap, right? Chicken salad on a bed of lettuce, egg salad here on the right, very good, lower carbohydrate, lower sugar lunches, and also very quick, convenient things that most diners, restaurants are serving. It's a picture from a patient that actually was very successful with weight loss. He lost about 80 pounds, and he swore by this meal. He was doing eggs with cheese, mushrooms, peppers, onions, broccoli. It helped his diabetes a ton. And you're not seeing a bagel or a wrap here a lot. This was filling and satisfying enough. Another picture from that same patient, he would make chicken salad with avocado, carrots, and I like to show these pictures because it's substantial, like it's a very filling meal. I think I would even have trouble finishing some of this, but that's what you want. You want to focus on savory and looking down and always seeing, is there always a carb there or not? Sometimes people do want some crunch. They do want a bread. They do exist. There's some good products out there. This is a Wasa cracker. There's other crackers too. I just don't know the names, but it's something to put something on so you have a vehicle like turkey and cheese, eggs, salmon, cream cheese. A lot of these things are very diabetes friendly. This would not raise your blood sugar much, and you can make a nice plate of these. Won't be too many carbohydrates, and it's got some whole grains in it. Desserts, usually everybody's favorite topic here. I have found some very good low sugar ice creams over the years that have helped a lot of my patients. A couple companies here is like Nix, Enlightened, and then I put these next as like Arctic Zero and Halo. They make bars that are great for portion control. So a lot of people struggle with wanting a brownie or a cookie or some ice cream. Highly recommend finding these lower sugar products and going for these instead. We also have dark chocolate. One rule about dark chocolate is you want to make sure the percentage is kind of high, specifically about 80%. If you go below 80%, the sugar really starts to ramp up in the product. So more of that bitter dark chocolate is pretty safe for diabetes and blood sugar. And then some other ideas would be things like I have people doing peanut butter in their yogurt or peanut butter with berries, or just making a plate for dessert, like a little dark chocolate with some raspberries. That's a wonderful idea dessert-wise. So label reading and ingredients, I'll go through these a little quickly. When you're looking at ingredients, this product right here on the bottom right, we see it just says peanuts. Unfortunately, nowadays, quite hard to find products that have clean ingredients like this. On the next slide, here's something you might find if you look at like a Skippy or something that's kind of like a diet product. You find a product with peanuts, corn syrup, sugar, soy protein, hydrogenated vegetable oils, and they're kind of just loading it up with lots of different things. And the question is why? And I don't have an answer for why, but we don't want to be having corn syrup and sugar and vegetable oils. We just wanted peanuts. We just want peanut butter. So make sure you are looking at ingredients and seeing if they're adding stuff in. You might be shocked if they're putting sugar in pickles and beef jerky, and you're putting sugar in breads. So just keep your eye out on those ingredients. Some very specific products here that I've found over the years that might be helpful for everybody. A bread that's pretty good is something like a bread called 647 bread. Back to that point about carbs and fiber. Fiber is one of the better one of the better options for carbs. Some yogurts that are very good. The ice creams that I mentioned are right here. Yasso, Nix, Enlightened, good products. They do make healthier pastas, I mentioned. Here's some of the names: Explore Cuisine, Barilla, Banza. The diet mindset thing. I'll touch on this briefly. And I say if you're ever adopting something, like you're going to start a new diet, and you're asking yourself, well, how long is this going to last? Like, is it like a 1 month diet or something? That's a red flag. You should make changes that are going to be lifelong. You should also never get rid of everything you love. There should be days once or twice a week where you're allowing yourself to have things like the 80-20 rule. 80% of the time do great, work hard, but 20% of the time, give yourself a break and you'll still be successful. Some of the positives of knowing when you're on a good plan is if you're saying, my clothes fit better, I have more energy, you see these non-scale victories, like I'm still having a sweet treat every day, or I'm still eating the food I love. It's my favorite thing to hear from patients when they're like, I can't believe I lost another 10 pounds. I just went out for ice cream with my family, or we went to this new Italian restaurant, and they're usually surprised. They're still able to kind of live and enjoy life. But that's because of the 80-20 rule. They're doing well 80% of the time. So on the last slide here, just have some questions. And we'll get to the misconceptions. I want to get to those, see what the audience has to ask, but feel free to submit your Q&As now. We'll save, I think, about 10 minutes or so for some questions. Is food labeled organic more healthy? So the answer is no, it's not more healthy. The only benefit there is some products are more at risk to be kind of covered in pesticides than other products. And that's usually the one where you're eating kind of the flesh of the product. And I think if you ordered or if you Googled the organic list, the Dirty Dozen or something kind of list like that, it kind of makes sense. Like, so for example, like strawberries are out, they'll be sprayed. And then if you're just popping a strawberry in your mouth, there's most likely you're getting more of that pesticide in your body. So there's some things that you would want to buy more organic, and something like common sense, like a banana, if it's sprayed with a pesticide, the skin covers it. So you would peel the banana and eat the banana, you wouldn't really be getting that pesticide because it was covered. So really want to be buying things that are organic as you're eating the flesh of it, where it's kind of exposed, is one of the rules I've heard over the years. Should you take a multivitamin? I think supplements are kind of a minor thing. Food comes first. I think food is 90%. Supplements are great, but I don't find multivitamins that important. I like for people to target their supplements a little bit better. Some of the top two I've seen, and maybe Dr. Patel would mention some too in her talk, but one of the best supplements out there now is something simple like a magnesium that helps with almost everything in the body, especially sleep. And then vitamin D is also pretty important. But I get asked about supplements a lot, and I think they're more of a side benefit type of thing, more minor. So, Kaylin, let's get to some Q&A here. I'd like to see, let's see what we got. Okay, I got it on the screen here.
So, is cottage cheese with pineapple a good snack?
Cottage cheese with a pineapple is a very good snack. Make sure you're buying plain cottage cheese, because when you buy the flavored products, there's syrups and jellies and jams in there and added sugar. Highly recommend avoiding those. Add your own fresh fruit. That's very important.
And then do you do telemedicine appointments? Do you need a referral from your primary care physician to schedule an appointment, or can you schedule an appointment without a referral?
You do need a referral from a doctor to see me. And we do, the telemedicine is a gray area. We do accommodate if it's needed, if it's like a reason why the person can't get here and it's important that they're seen. And I think, government rules change year to year about telehealth, but right now we make accommodations for telehealth. So we are now making it happen if the patient can't make it here.
Another question about insurance. Are you inner circle with HMH hospitals, and you offer telehealth is the second part, but you just answered that.
Yeah, the hospital, HMH inner circle, we accept, the hospital accepts pretty much many insurances. But it's usually a question for the insurance company if they're going to give you coverage with a dietitian based on your reason. That's the only barrier, is people want to see me for all kinds of reasons, whether it's prediabetes or weight loss or heart disease. And then unfortunately, the insurance makes that call. And then there's some disease states like diabetes or kidney disease where they give a lot more coverage. And then unfortunately, I've seen people saying like, oh, I want to see a dietitian for weight loss. And then the insurance company says, oh, we'll give you maybe 2 visits for the year. So it is a direct question for the insurance company and how many visits they're going to give.
Is there a type of magnesium that is better than others?
That's a good question. I know there's about 2 or 3 different kinds. I take one that's a combination one. One of the better ones is usually magnesium glycinate, if you're specifically looking for the one for sleep. But there are some that have multiple forms. like a magnesium, like a complex magnesium would have two or three different types of magnesium in there.
And actually, that's a question as well. Magnesium glycinate for sleep.
Yes, yeah, that's right. Magnesium glycinate for sleep. There's magnesium citrate. Um, but that is one of the top supplements I've been seeing over the years. Is a very common theme that it's good. It helps with our nerves, it helps with our muscles, helps with our energy. It's really powerful. Yeah, it's really good.
And sticking to the magnesium question, any magnesium citrate glycinate amount?
That's a good question. I think that depends person to person, depending on your height and your weight. I think that a stronger dose of magnesium is probably 600 milligrams. It's a lot. I think they can go as low as 200 to 400 to 600. My recommendation is to start low and see if you're noticing a benefit. Don't start high. So I think just some of these reputable companies, like these what do they have? Nature Made and like Target and Walmart, they have these very reputable supplement companies, and you'll see the different ranges of magnesium on there. And I think it goes from 200 to 400 to 600. I would start low.
Okay. And do you recommend eating a small snack at night for someone who has high morning blood sugars?
Very good
I
question.
have high morning sugars even if I haven't eaten in 12 hours.
Yeah, very good question. That's something called the dawn phenomenon, which is something still not understood by the medical community. Even like the Mayo Clinic and the CDC still are unsure why people, don't eat. The assumption is that if you don't have anything all night after dinner and then all night till 12 a.m. and then the body's like, well, we haven't had food in like 10 hours, and then it's 1 a.m., 2 a.m., 3 a.m., 4 a.m. The body, we believe the body starts to make sugar because you haven't given it anything. So sometimes people don't eat anything and they wake up and their sugar is very, very high. So it doesn't work for everybody, but for a lot of people, intentionally having a snack at night might help reduce that. And I do see that work. One of the rules there is the snack should be kind of specific. You do want kind of a carb combined with a protein. That could be something like an apple with peanut butter, maybe a half an apple or something with peanut butter, or yogurt with some berries. That's some personal experimentation. When I'm working one-on-one with a patient, I might have them try 1 week of a certain kind of snack, 1 week with another kind of snack, and we find out what works best. But that's a good question. That's unique to the individual most times, because in other cases with diabetes, sometimes you have people not eat and their sugar actually gets better. But that it's called the dawn phenomenon.
Is it good to go 12 hours with no food while sleeping?
Yeah, for most people, for people who don't experience that dawn phenomenon, it's typically good to not eat at night. So, you had dinner at 6 and you're full for the rest of the night and you go to bed and you wake up in the morning, that's a good 12 plus hours where you haven't had any food. Most people are going to notice benefit from that. But if you're in one of those cases where, your sugar's high in the morning, you might need to throw a snack in. That's something individualized where I'd help a person one-on-one with that. That changes person to person. But in most cases, it's good to do that 12 hours.
I actually have a question. How can people test their A1C? I know you mentioned checking your A1C. How do you find that information?
That has to come from an order from the doctor, and most doctors are going to have no problem ordering an A1C. They order them every day. So that's a pretty standard order. And then you would have to go get actual blood work from like LabCorp or Quest.
Okay. And somebody said, how about staying away from fillers, magnesium stearate? And is it okay for patients with DM that have high cholesterol to eat eggs daily?
That was the first part again?
How about staying away from fillers, magnesium stearate, stearate,
Mhm.
Stearate?
Yeah. And then eggs or something you said?
And is it okay for patients with DM that have high cholesterol to eat eggs daily? I don't know what DM means. I'm sorry.
Diabetes. They're talking about diabetes mellitus. I
Oh,
was confused by the first two parts, but I can answer the last part about the eggs. Eggs are wonderful. So a lot of the bad rap eggs got over the decades. Even the American Heart Association came out and said, there was some confusion about that. Like the cholesterol in food doesn't affect us as bad as they thought it did. So eggs are an incredible food for diabetes, and it's fine to have eggs. The fillers thing, I think it's yeah, I don't know what they mean by fillers, but it's good to avoid fillers in products.
The next question is Rise mushroom coffee. Is this safe for diabetic people?
I'd have to look up. I do believe it is fine, but I'd have to look that up.
How do you feel about intermittent fasting?
I'm a big fan of intermittent fasting. Usually it's misunderstood. People think it's something very intense and like intimidating, but it doesn't actually have to be. In most cases, if somebody wakes up and they have diabetes and high blood sugar and they have trouble with their weight and they wake up and kind of force feed themselves a big breakfast, they might not be seeing the most results. And somebody like that might benefit from kind of waking up, having their coffee and waiting an hour or two and kind of waiting for their hunger to build up and then to having like a little bit later of a breakfast, and they do see some good results from that. It could be a very light form of intermittent fasting. Another very light form of intermittent fasting is what we talked about before, which is, somebody who's in bed eating at 10 or 11 p.m., having some snacks, and then they set a new goal saying, I'm going to start trying to not eat after 8. That's a good thing. That's going to help them in most cases. And that's technically intermittent fasting in a light form. Where people get a little too carried away is if they're like, I'm not going to eat all day till dinner. I'm doing a fast. I'm fasting for 20 hours. That also falls in the intermittent fasting category name, and that's a bit intense. So I wouldn't say people should do that. That's a little bit much.
Okay, and then I have two more questions. Is it okay for hyperthyroidism patients to have more than 12 hours of fasting?
Yeah, I don't see why that would be a problem.
Should you do egg whites or the whole egg?
The whole egg.
And is it okay for patients that are on insulin to do intermittent fasting?
I'd say no. The provider would have to do that with you, because if it's a very light form of intermittent fasting, it might be okay, but I wouldn't jump into anything intense. Like if that depends on the timing. You have to be very specific with your insulin, because if you take insulin and then fast for hours, you can get low blood sugar. So that's something you want to be very cautious about. That would have to be discussed with your doctor or your provider.
Okay, and the last question is how does salt consumption interact with diabetes?
It doesn't play too much of a role, to be honest. I have people consume moderate amounts of salt, um, and it's no issue. It's really no big deal, the salts. Usually people come in, a salt restricted diet is usually around 2,300 milligrams per day, which is a good amount of salt. People who are eating very salty foods like soups and bacon and frozen dinners, they're going 3,000 to 4,000 milligrams more of sodium, and that's pushing it, especially if there's a concern about like your blood pressure. But no, salt doesn't play too much of a role there.
Okay, thank you so much for this information. This was great. Great questions. Oh, one more. Is oatmeal something that should be avoided?
That's a good question. So kind of a controversial take there is, with diabetes, I'm not putting my patients on too much oatmeal, to be honest, because what they do with oatmeal is they usually buy the sweet one. So it's like a sugary oatmeal, and or they just have their oatmeal, but then they put more sugar like honey or brown sugar, and they put like lots of fruits on it. So what you have there is a carb, and they put more carbs and more carbs and more carbs. So it ends up being like a very high carb oatmeal. But if you're just having plain oatmeal with some healthier toppings, then it's okay. But in most cases, people get too carried away with the oatmeal, and it makes it not the best diabetes meal. Surprising answer, but that's the truth.
Rolled oats, okay?
Same answer there. If it's
Okay,
just oatmeal or rolled oats plain, maybe some berries thrown on, it's good. But people don't get carried away with adding all these flavors and honeys and syrups and things.
absolutely. Thank you so much for this. So we're going to turn the floor
Happy.
over to Dr. Patel. Um, Robbie, I don't know if you want to stick around in case there are some questions, but we'll turn the floor over to Dr. Patel.
I'll stick around, sure.
Thank
All
you.
right. So, hello, everybody. Just making sure you are able to see my screen.
Yes, we can.
All right, so welcome. Good afternoon. My name is Dr. Reema Patel. I am the medical director at Old Bridge Medical Center, Diabetes and Endocrinology Center, and I am with Hackensack Meridian Health. And let's talk diabetes. So thank you, Robert, for this amazing presentation. We are kind of going to carry over and piggyback on what Robert talked about. We are going to get to the basics of what is diabetes. So what is diabetes? It is a high blood sugar or a sugar problem, as most of you know it. It is the inability of the body to either produce insulin or to use insulin properly. Now, we talk about insulin. So, what is insulin? Insulin is a hormone that is produced by the pancreas. And one of the main roles for insulin is to absorb the glucose from the blood. And again, as I said, the major problem with diabetes in patients is either they don't have enough of insulin or they just can't use it efficiently. So, we talk about diabetes. There are many kinds of diabetes. So, what kind of diabetes are there? Type 1 diabetes, where there is deficiency of insulin. Type 1 diabetes usually begins in childhood or earlier than 35 years of age. Type 2 diabetes is where they have a defective secretion, or what is more commonly known as insulin resistance. Again, the body has insulin but is just not able to use it efficiently. That is what type 2 diabetes is. The other kind is gestational diabetes that women get during pregnancy. So these are women that do not have diabetes in the past, but once they get pregnant, they are told that they have diabetes, also known as gestational diabetes. There are other kinds of diabetes like MODY and neonatal diabetes that are less common, but the majority, more than 90% of the cases that we see, are for the type 2 diabetes, which is associated with insulin resistance. So, we are talking about diabetes, but more importantly, how are we going to prevent diabetes? Again, as Robert said already, small changes lead to big impacts. As was discussed already, I also tell my patients not to just focus on short term goals, but to follow and implement and change a lifestyle in a way that is more persistent. It's not something that you do today and go on for a month or 2 months. It's a change that you want to make that you can sustain. And the important thing is, do what you enjoy and do what you can do, because those are more likely to be more long term goals that you will be able to achieve. So, we talked about diet, we talk about a low carbohydrate diet. There is some data that following a Mediterranean diet is useful. There is also some data about following a vegetarian or a plant based diet. Again, Robert talked about this, but again, we do definitely focus emphasis on whole grains and legumes and nuts, fruits, and vegetables, and minimal amount of refined or processed food. Now, when we talk about weight loss, how much weight loss should I attain? And again, the recommendation for patients who are either overweight or obese, which is based on your height and weight, is a reduction of 5 to 10%. So, if you want to prevent diabetes and if you're overweight or obese, a reduction of 5 to 10% in your weight does lead to improvement of prediabetes or a reduction to develop diabetes. When we talk about physical activity, the recommended is 150 minutes of moderate physical activity. It is not taking a stroll in the park or walking slowly. If you're walking, anything that gives you just a little short, you should not be able to have a normal conversation if we are talking about moderate physical activity when it comes to walking. We also encourage incorporation of aerobic training, resistance training. A lot of us are working a lot of patients are working from home these days, especially after the COVID pandemic. And while they're working from home, majority of their time is on the computer. So break up prolonged sedentary period. Take a break, take a walk. Even if you are at work, take a quick walk, break up your long sedentary period, which will definitely help in preventing diabetes as well. Now, we talked about screening. Again, there are definitely guidelines on who should be screened for diabetes. As I said, type 1 diabetes usually is a deficiency of insulin, where you just don't have insulin in your body, and is usually diagnosed much early in life. So, if somebody has a family history of type 1 diabetes, we usually educate the family members about the signs and symptoms of type 1 diabetes. However, routine screening just because you had a family member with type 1 is not indicated if you don't have any symptoms. The more common, which is the type 2, as we discussed, is more than 90% of the patients with diabetes have type 2 diabetes who should be screened. So, anybody who is overweight or obese, anybody who has a family history of diabetes, a woman who has history of PCOS, which is polycystic ovarian syndrome, or PCO as it is called these days as well. If a woman has a history of delivering a baby that is more than 9 pounds, if you have high blood pressure, high cholesterol, these are risk factors that you should be screened for diabetes. Certain ethnic age groups are also at a higher risk of developing diabetes. For example, Asians, African Americans, Hispanics, and Native Americans. Again, also increases your likelihood of having diabetes. Again, these are the patients that should be screened for diabetes. And if you're more than 45, even if you don't have any risk factors, you should be screened. So important to know, important to screen for diabetes, because again, if you have it, you want to detect it early and you want to take care of it early, because that is how you will be able to prevent the complications. Now, Robert talked about this briefly as well. Again, how do you diagnose diabetes? And Kaylin, you asked this question as well. A hemoglobin A1C, that is a word that probably all patients who have diabetes know, because in my patients, we talk about the hemoglobin A1C or the A1C at every visit. What is it? It is an average blood sugar over the past 3 months. It helps us diagnose diabetes. It helps us tell how you are doing with your diabetes. So, again, it has various uses as well. And as discussed earlier, it is a blood test that is ordered by your provider, and that is how you diagnose diabetes. So, any number that is either more than or equal to 6.5% is diabetes. Other ways of diagnosing diabetes is that you go for blood work, fasting blood work, and if your sugar is more than 126, at least after 8 hours of fasting, that is also considered a diagnosis of diabetes. Or you have a blood sugar done in the middle of the day, which is called as a random glucose, when your sugar is more than 200, or a glucose tolerance test, which is not traditionally or typically or commonly used unless women are pregnant, then the glucose tolerance test is used. If you have a sugar of more than 200 on the glucose tolerance test, these are all ways to diagnose diabetes. And again, there is an MI at risk test. If you go online on the American Diabetes Association, the ADA website, and if you search MI at risk test, you will be able to find this and you can input your data. And this will give you information to see if again, these are for those who do not have diabetes. So, this is a risk test to see if you are at a higher risk of developing diabetes. So again, pre-diabetes. We also saw a thermometer, again, to get into the basics or the specifics of what is normal, what is pre-diabetes, and what is diabetes. So we talked about in the prior slide that any number that is more than or equal to 6.5 is considered diabetes. Again, we are talking about the hemoglobin A1C, which is the average blood sugar over the past 3 months. Any number that is less than 5.7% is considered normal. And any number in between, which is 5.7 to 6.4%, is considered prediabetes. And we saw in one of the slides the prevalence of prediabetes as of 2021 is significantly high. Adding on to that, a lot of patients with prediabetes or diabetes don't even know that they have either prediabetes or diabetes. We'll talk about the symptoms. So that is a problem because a lot of times there are no symptoms. Again, coming to that, What are the symptoms of diabetes? A lot of time, as I said, there are no symptoms. When the sugars are very high, then patients they may feel thirsty a lot. They may need to go to the bathroom a lot. They may have wounds that are very slow to heal. They may complain of some blurry vision, some tingling and numbness. They may have unintentional weight loss, and sometimes patients have very high blood sugars and come to me and say, "Hey doc, I lost 15 pounds in the past couple of months and I'm not even trying." So that is one of the symptoms, especially of uncontrolled diabetes. In women, one of the symptoms is recurrent vaginal or yeast infections can happen out of nowhere. That is also something that should trigger you for testing for diabetes. And if you have diabetes, you should get to a better control level. Again, some of the symptoms. So, what are the signs and symptoms that a patient with diabetes should not ignore? Having a low blood sugar, having a high blood sugar, or having any symptoms related to complications of diabetes. So, what are the symptoms of high blood sugar? As I said, patients may need to pee a lot, they will have increased thirst, blurry vision, and in very severe cases, they may even have nausea and vomiting and stomach pain. What are the symptoms of a low blood sugar? Patients usually feel shaky. They have palpitations, which means that they feel that their heart is beating very fast. They may feel dizzy. They may sweat a lot. They may feel anxious. These are symptoms of low blood sugar, especially in patients who are taking some oral medications that increase the risk of low blood sugar, or they are taking insulin. Low blood sugar can happen. And again, what are the complications of diabetes? If you have symptoms of a heart attack, chest pain, stroke, weakness, if you have any tingling, numbness, again, those are symptoms of complications of diabetes that somebody with diabetes should not ignore. So again, I like to address that in every visit in a patient with diabetes that I see. I say, okay, let's get back to your ABCDE. How is your ABCDE doing? The A stands for the A1C, which we talked about. B is for blood pressure, C is for cholesterol, D is for diet, and E is for exercise. We touched upon most of these in the prior slides, but again, what I'm trying to say is that treating a patient with diabetes just doesn't come with treating their blood sugars. It comes with managing their blood pressure, their cholesterol, their weight, and diet. So it is a wholesome approach rather than a tunnel approach that we follow while managing a patient with diabetes. Now, talking about how can women with diabetes prepare for pregnancy. Now, as was in the slide presented before, the prevalence of diabetes, all kinds of diabetes, type 1, type 2, and gestational diabetes, uh, is increasing. And in hand with that, prevalence of diabetes in pregnancy is increasing as well. Again, parallel to the worldwide epidemic of diabetes that we have. Having diabetes does increase the risk both to the mother and the fetus. And so when we talk about counseling or preparing patients for pregnancy, the counseling really starts from puberty and carries on until the women are in their reproductive age group. So again, the counseling starts very early. It is important to achieve a glucose level as close to normal as is safely possible. And the ideal A1C to achieve is an A1C of less than 6.5%. The important thing is as safely possible. And what I mean by that is we want the women to get to very good levels as low as possible, as close to normal as possible, but without increasing the risk of low blood sugar, because that itself increases some risks as well. Now, the importance is also to maintain your target blood sugar both prior to and for the entire duration of pregnancy. So it's not just important to get women to goal before they are trying to get pregnant, but again, in patients who are pregnant, we very closely monitor their glucose levels for the entire duration of pregnancy. The There is a very big importance of the need for multi-specialty care. In women who are pregnant or are planning to get pregnant, there is a multi-specialty care approach. You need an endocrinologist. If patients have diabetes and are pregnant, they also, besides their gynecologist and obstetrician, need to establish care with an MFM, which is maternal fetal medicine. I can't tell you how important seeing the registered dietitians and the certified diabetes are. We have a couple of dietitians and a couple of CDEs in our practice, and I don't know how we would practice without them. So it is a team approach, it is a group approach. I think every specialty has their own specialty that they offer, and it is very important to be treated as a whole with all the specialties. Again, preconception care for women with diabetes that are planning to get pregnant. We did talk about this in general as well, but again, nutrition definitely is a big focus. Focus on the macronutrients, focus on nutrient dense foods, focus on vegetables, legumes, whole grains, healthy fats like nuts and seeds and fish, as were shown in some of the pictures that Robert showed. We also talk about physical activity. We also talk about diabetes self care education. So, medications and insulin is just part of it, but majority of it is really your self-care and your education and how you can get your diabetes better. It is also important to screen for other medical problems that can coexist in patients with diabetes and the complications. So that is also an important part of taking care of patients who are planning to get pregnant. One important thing that I would like to point on is the screening recommendation for diabetic retinopathy. Diabetic retinopathy is a complication of diabetes that affects the eyes, specifically the retina portion of the eye. So the recommendation is for the women to have a dilated eye exam to occur before pregnancy and then also in the first trimester as a start. And then they should be monitored every trimester by the ophthalmologist, and also are recommended to have a screening 1 year postpartum, meaning 1 year after they deliver, they are recommended to also have a screening. Now, this is a very general screening recommendation. This changes based on what the findings are, and the exact recommendations on when the next screening should be is really best determined by the ophthalmologist who is doing the screening. They may call you early, they may call you later. It is best to listen to the ophthalmologist, but this is what the general recommendation is. There is also a recommendation for the use of CGM. CGM, as probably a lot of you know, is continuous glucose monitor. There is a recommendation, especially for patients with type 1 diabetes, those ones that start very early on. Type 1 diabetes are the patients that don't have insulin and they are insulin dependent, are more brittle or more labile in terms of their glucose because of the deficiency of insulin. So, use of continuous glucose monitor is recommended in patients with diabetes, because we do know that when this is used in addition to blood glucose monitoring, it does prevent complications. Again, this is my last slide. The glycemic goals during pregnancy, as I said, when I have patients who are pregnant and who have diabetes or gestational diabetes, the goals are pretty strict. The ranges that are recommended is, as I said, as low as possible, at least less than 6.5 or 6. But again, as safely as possible, we have to make sure that we are not increasing the risk of low blood sugar. If you have a fasting blood sugar, the target is less than 95. We also ask patients to monitor their sugars 1 hour and 2 hours postprandially. So the goal 1 hour postprandially is to have a sugar of less than 140. And if they're checking their sugars 2 hours postprandially, meaning 2 hours after eating, the goal is to have the sugar to less than 120. And as I said, the A1C goal really is pretty strict. It is less than 6%. The goal here I'm talking about is during pregnancy. I would like to say that in terms of patients who have diabetes, when we are not dealing with the pregnancy or the preconception care, the general goal that is set by the ADA or the ACE or the other societies, the endocrine societies, is less than 7%. But that is a generalized goal. The importance, as Robert mentioned as well, is that this is an individualized care. The goal is individualized. How old the patient is, what other medical conditions the patient has. Do you have heart disease? Do you have kidney disease? Are you at a high risk of low blood sugar? There are so many factors that come into play when we decide what what is your goal hemoglobin A1C, and this also helps us decide what medications you should be taking for diabetes. So one question that I would like all of you to ask, if you have diabetes, if anybody here has diabetes, when you go to the treating provider that treats your diabetes, I think it is important for you to know. Ask them, what is my target A1C? Where should I be at? And based on everything that I said, you will get an answer from your treating provider, and that will help you understand as to where you are in your diabetes journey. Are you at goal? Do you need to work a little harder? If you have any side effects related to medications, if you're having low blood sugars or if you're having high blood sugars, like was brought up earlier in the visit, earlier in this conversation, talk to your treating provider, and a deeper dive is needed to understand what the problem is in order to treat what the problem is. And that is all I have. This is my contact information. I did not see the screen, Kaylin, so if you can read the questions, if there are any, I'll be happy to answer that.
Sure. And just a reminder, at the bottom of your screen is the Q&A button, and that's where you can ask your questions anonymously. I have one question. I have heard many doctors following normal labs and avoiding symptoms. How do we trust the lab results?
Um, so let's get back to that. So again, there are various ways of following a patient with diabetes. If you're talking about somebody who has anemia or who has chronic kidney disease, a hemoglobin A1C may sometimes not be reliable. There is another test that is called as fructosamine, which I order in a lot of my patients. The treating provider usually has data to what your blood sugar pattern is. If you have a CGM, that is a continuous glucose monitor, we are also looking into that. So when we analyze or treat or evaluate a patient with diabetes, usually there is not one piece of data that we are looking at. We are looking at multiple pieces of data to make sure that all of them are making sense.
Okay. Symptoms of low blood sugar can resemble a panic attack. How can you tell the difference?
The only way is really to check your sugar. So, yes, you're right. You may feel like you are anxious. You may have palpitations, as I said, that you may feel that your heart is beating fast. But yes, the only way to confirm is to check your blood sugar. Again, if you have a continuous glucose monitor, sometimes before the low blood sugar happens, the monitor will guide you with an arrow down to notify you that, hey, look, your sugar is going down, do something about it. But if you don't have a continuous glucose monitor, the only way to check is to check a finger stick using a glucose meter.
Okay. That was, do you have any additional advice for diabetics with a high morning blood sugar?
So it depends. It's very variable. I ask a lot of questions to my patients who come to me with a high blood sugar. What time was your dinner? Well, if the dinner was maybe 7, 8 o'clock at night, try to have an earlier dinner to see if the blood sugars get better. If you're having a very early dinner and then having a snack that is high in carbohydrates, that is also going to cause a high blood sugar in the morning. It's going to reflect that. Dawn phenomenon, as was mentioned earlier, is a phenomenon that is caused by the release of some hormones like growth hormone, cortisol, and all these hormones in patients with diabetes. The response is exaggerated, that despite not eating, around 2 o'clock, 3 o'clock, or 4 o'clock, the blood sugars rise. Easier to say again if we have a continuous glucose monitor. Otherwise, sometimes I do end up telling the patients to check their sugars in the middle of the night. So say, for example, if your meal was early on, you did not have a snack at bedtime, those factors are taken out of the equation, and you're still waking up with the morning sugar, then I usually tell my patients, check your sugars in the middle of the night to see where you are. You may be, as Robert said, responding to a low blood sugar, especially if you're on insulin or some other medications that are causing low blood sugars. Your body may be reacting and responding by secreting some hormones to counteract the low blood sugar. Or sometimes it may be just that despite having no low blood sugar, you may still be high. The treatment is very individualized. There is no one size that fits all. There are a lot of questions that we ask the patients and determine what the best answer is. But yes, one in general, you can check your sugar in the middle of the night to see if you are having a low blood sugar or if you're already high in the middle of the night.